Good. 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 Yeah. All right, and go face down.
I've been having really bad neck pain for a long time, and along with my lower back as well. And I'm just trying to see like what could be the issue.
Okay. All right. Well, how is that affecting your day-to-day activities?
I usually cannot bend properly. Like if I drop something, I wouldn't be able to pick it up or anything like that. Or really go out or do anything.
Okay. So you can't go out, you can't do stuff. Makes it hard to work, I assume.
Yeah.
Okay. So neck pain for a long time, back pain. All right. All right. Well, let's check you out and get you fixed up. Now you turn your head left, right, and look straight ahead.
So this way first. And
That's fine. Yep. Look left, right. All right. So we got Cheyenne here. Biggest thing with this part of the X-ray is she got about 2/16 of a tipping in her atlas, the top bone in the neck, which is giving her about 1.5 degrees of atlas laterality. She has about a 1/2 degree head tilt, a little bit of lower angle. And then the hips, just about 1.5 millimeters of tipping. So we're gonna adjust her on the right side. This is tough because it's measuring, you can't quite see it in the camera, but it's measuring about 1/4 degree, well, 15 degree. So do you round up to nothing or do you take it at 1/4 degree? There's almost nothing in there. There's a little bit of rotation at the second bone in the neck. So I'm gonna take it at no rotation and we'll see. We'll take a post x-ray and we'll see if that's the right call or not. That's the hard part with what we do. 1/4 degree can make a difference for some people. So we're gonna take it at no rotation. We're gonna adjust her 1 inch high on the right. So I'm gonna come with my hands here at the top of the neck 1 inch high. And then we're gonna block her with a sharp headpiece and let's see how she does.
I remember this time. This way.
Yep.
I forgot last time.
Trying to lean.
Sorry.
No, you're fine. Just
Lost my balance a little bit.
You're okay. You just look straight ahead. You're carrying about 20 pounds more on the left, leaning to the left. Right leg is short. So we want to see that relax and be able to stay relaxed between visits. Let's have you sit up facing that way. Much better. Legs relaxed, balanced. Very, very good. Very good.
That's a good sign.
Yes.
Upper back still up a little bit, might need to rest. But the pelvis is much better, so that's good.
Check for tension, lack of motion, the two biggest things.
Yeah.
So let's have you lift your right leg as high as you can. Good, and down, and the left. And down. One easier than the other?
Yeah, the right one's a little hard.
Where do you feel the tension or resistance when you lift
On the right
it?
side.
Whereabouts? We're out here, more in here,
No.
right in here? Yeah. So that typically means is that the hip Yeah, and it doesn't want to go when I push it. This one goes very easily. This one doesn't want to go.
Yeah.
What that means is that the right hip is rolled backwards. So we want to basically mobilize it in the opposite direction to release that tension. So lay on your side, facing me. Good, right away. Good. Good, beautiful. Let's have you go face down. Yeah, that's better. You're moving better. Okay, lift your right leg. Good, and the left. Okay, how does that feel?
A little bit better.
Do you feel it anywhere else, any restriction?
Just on the left side now, just like a tiny bit, not much.
Whereabouts?
On the same spot as the right, but just like a little bit.
When you lift the left or when you lift the right?
When I lift the left.
Okay. That happens. Alright. Good. Let's have you go face and lift the right. Good, and the left. Good. How did that feel?
A lot better.
Yeah, looks. Yeah, this feels good now. Just some tension in here. Mobilize the mid back, release some tension in there. Not gonna change alignment. That's what the NUCA, the neck adjustment does, but good. Yeah. Beautiful. Good. We'll set you up an appointment. I want to do another set of re-x-rays, make sure everything moves exactly how we want. Then we'll check you again, see how you're holding. All right, so it's been about a month. Had a few adjustments. Her hips went for 1.25 millimeters or 1.4 to half. So that's good improvement there. That's what we want to see. So reduction. And even with the small measurements, you typically want to see reduction. So that's a good sign. The next, we want to see the nasum. So this one I was interested to see because I wanted to see what we should do. So you can see here, that's where it was, and this is where it is now. So the upper neck is more level, the head is about the same, but the neck now is off by 4 degrees. We'll switch like this instead of a half. And typically to get the neck, you have to get the rotation right. So I'm going to, we're not going to stop there. I'm not happy with that. And then after the adjustment, her pelvis did center, but her upper back stayed off center. So that is, obviously, we're not going to get the best results if we leave her there. So I'm going to go with a 1/4 degree of rotation instead of no rotation, and then we're going to re-x-ray again and make sure that gets it. How are we doing?
Not bad.
How's the neck and back feeling?
Pretty good, but yesterday was pretty bad.
The neck or the back? The neck? Neck.
Yeah, it feels like pins and needles.
Okay.
I don't know if that's like a good sign.
You're kind of like halfway where we want you. I know we were kind of talking about that last time, but now the head is centered, and there's no rotation, but the lower neck is still shifted off center. So we got to bring that back, and then you should be in really, really good shape. So with how the head and neck are in position, we're going to sharpen the head piece. We're going to come about 2 3/4 high, 2 posterior. 2 posterior untwisted the neck, and this should allow us to get on top and then drive your neck back center. And then we should be where we want to be. Gotcha. And come on up. Let's have you go face down. So the low back's been feeling good? Better?
A little bit.
Okay. Lift your right leg as high as you can. Good, and down. And the left. And down. One easier than the other? Which one was easier?
The right one is a little bit, but it was still
looks way better. And the left. How did that feel? The left was still heavy?
Yeah.
Let's have you lay on your right side facing me. Now we're going to open up this left SI joint. Good. And face down.
Ooh.
I know. And lift the right. Good. And the left. Good. A lot better. Beautiful.
I've been working on it slowly.
You look good there. Let's have you come up. Lift your right leg.
Wrong one.
That's all right. And the other. How does that feel? Left one's still more difficult?
Yeah.
Yeah. Go on your back.
I think it's because it's a little tense. Maybe.
It's all right. We just got to open up that SI joint. So, on your back, on your back.
Oh, yeah. Yeah.
Oh, you're fine. Face down. And lift the right. Good. And the left. Good. How does that feel?
Better.
Still harder on the left?
A little bit.
Good. Good. And face down. Beautiful.
It's like all your joints is like.
And lift the right. Good. And the left. Good. How was that?
Better.
Did it feel about the same?
Not really. It's
Not quite.
starting to get better.
Oh, it's better than it started, yeah.
Yeah.
Did they feel the same compared to each other?
Not really. That's
Not yet. Go on your side. Clear this and it should be good.
all right. This side.
Almost done. Almost done.
Almost.
Good. Good. A little more. Good. And face down.
Not all of it wanted to pop, but some of it did.
And lift your right. Good. And the left. Yeah, we got it. Okay.
Yeah, we got it.
All right. All right. And we got it. So that was the difference. So you can see from when we took it with no rotation, about 4 degrees to now a quarter. So that was better than we started. Way better, about a 50% reduction, upper neck level, head level. Hips have maintained, continue to maintain and are better. And everything looks better. And she's completely centered when she's standing, and her legs are perfectly relaxed and balanced when we checked her. So this illustrates why post x-rays are so important. You're never gonna see a quarter degree of difference when you're checking someone, either palpating or visualizing issues. That's why post x-rays, and I always strongly encourage doctors, patients to get post x-rays. And this is a good example. This took us a couple to get it right. And sometimes that's what it takes. Sometimes it's a quarter degree difference, and then bang, everything clicks. And everything is showing improvement. There's less rotation in the neck, head and neck are more centered, hips are more level. When that happens, we're good. We know that the innate's on the job, so the nervous system is going to be, the brainstem, the nervous system will have less pressure and tension. The body will be able to heal itself. The muscles and joints will be more balanced and centered as they're moving through gravity, so they will be able to heal themselves. And then it's just up to the recuperative capacity of each patient for how much improvement takes place. But Cheyenne's, she's looking much better. She's feeling improvement, and she's going to continue to feel improvement as long as we make sure this holds. All right, Cheyenne, it's been about 2 months. When you came in, low back pain, upper back pain, mid back pain, severe neck pain, severe sciatic pain down both legs, severe. Felt like your back was going to give out a lot. It was difficult to get your pants on. How are we doing now?
100% better.
Awesome. Does the back ever feel like it's going to get out anymore? Any pain when you're getting dressed or bending over, any of that? Awesome. Great. Perfect.